Good afternoon. I'm George Guastello, President and CEO of Union Station. Union Station's historic home, an image of bi-state cooperation, is now the home to provide vital information to our community. Since 1914, we have been that symbol where people come together and gather and celebrate in good times and in bad. During war times, we have been here. During great times and celebration, we've been here. And today, we are here again, under this historic clock, to give vitally important health information. Behind me stands our civic leaders that have not been together in unity since the day that we saved Union Station in 1999. We stand today in unity and support as we move forward to the future. I'd ask all the elected officials to stand, and we are now ready to begin information that our public needs. Thank you, and we look forward to gathering again in Union Station as we celebrate our future.
Good afternoon. I'm Dr. Alan Greiner with the Unified Government, Wyandotte County, Kansas City, Kansas. There, I serve as the Medical Director and Public Health Officer. I'm here representing all of the regional medical directors and public health officers of public health departments, municipalities, and counties across our metro region. Yesterday, all of the public health officers signed orders that require residents of our counties and municipalities to stay at home as we continue to try and slow the spread of COVID-19. We will work with intensive social distancing and a set of policies that we believe will flatten the curve of this disease. It is important to note that the core 4 Kansas City metropolitan municipalities are acting in unison by issuing this stay-at-home order. It is critically important that we act as a unified front to slow the spread of COVID-19, not just in one community, but throughout the Kansas City metropolitan area. Without these efforts, we believe the spread will continue and our healthcare systems will be overburdened. This order goes into effect at midnight on Tuesday, March 24th, and will stay in effect until April 23rd. Now, let me go into some of the details of the public health order. The order addresses 2 separate issues: essential activities and essential businesses. It directs all residents to remain in their place of residence, except for those that are conducting essential activities and the essential businesses. Examples of essential activities include obtaining medicine, seeing a doctor or healthcare provider, seeing a veterinarian with your pet, getting necessary services, supplies, food, or other products that allow you to maintain your household, engaging in outdoor activity so long as social distancing is practiced so that individuals are 6 feet away from each other at all times, performing work to provide the essential services that I will list below, caring for a family member, working or getting services from hospitals, clinics, or other providers, or caring for elderly minors, dependents, or those with disabilities. It is important to remember, even when people leave their residence to perform these essential activities, they must practice social distancing. They must remain 6 feet away from each other at all times. People who are at high risk for severe illness from COVID-19 are urged to stay in their residence except to seek needed medical care. People who are sick may only leave their residence to receive medical care in accordance with these guidelines. Now, let me describe some of the essential businesses. They include hospitals and healthcare facilities, child care facilities, pharmacies, health supply stores, grocery stores, farms, gas stations, banks, garbage collection, hardware stores, educational institutes so that they can facilitate distance learning, businesses that ship or deliver groceries, food, or other goods, child care facilities, professional services such as legal and accounting services when necessary to maintain compliance with legally mandated activities, newspapers, radio, television, and media resources. Essential businesses must take proactive measures to comply with the social distancing requirements. That means structuring the workplace so that individuals are 6 feet away from each other and maintaining signage, making hand sanitizer and sanitizing products available, implementing separate hours for vulnerable populations, such as senior citizens, and using online resources and communications so that as much as possible, others can conduct businesses online or by phone. We encourage citizens not to rush to urgent care facilities or emergency rooms to seek COVID-19 testing. We believe that overwhelming the healthcare system will prevent the seriously ill from receiving the treatment they need. If you believe you may have COVID-19, call your primary healthcare provider. All our municipal residents should think that they should also consider reporting any symptoms they have to their local healthcare provider, or there are online resources such as the wykokck.org/COVID-19 website. One last thing to remember. The best way to protect yourself and your family and others is by practicing good personal hygiene. That means washing your hands with soap and water for at least 20 seconds, covering your cough or sneeze, staying home if you're sick, avoid touching your face, don't shake hands. Residents across the municipality with questions can utilize the 311 line to have questions answered, and they can also visit websites of each municipality and county, again, such as wykokck.org/COVID-19. Thank you for your time today. Now I'll turn the podium over to Mayor and CEO David Albee with Unified Government, Wyandotte County, Kansas. Thank you.
Good morning. Thank all of you here present today, and congratulations to all of us for practicing good social distancing. I want to thank Dr. Greiner and all the medical officers here for their leadership in bringing forward this urgent recommendation that our region implement a stay-at-home order. Your expertise and decisiveness will help to limit the spread of the coronavirus, and your efforts should inspire all of us to respond in kind. As Mayor and CEO of Wyandotte County in Kansas City, Kansas, I extend my gratitude to the leadership of the Core 4 group as well, as we all came together to decide upon this action of stay at home. And I extend my gratitude to the citizens of Wyandotte County and of the entire region for their support of these efforts. Make no mistake, we find ourselves in difficult times. We are confronting a serious threat to our health, to our lives, to our livelihoods. A few have said that these actions are done out of fear, and I, for one, freely admit that I fear for the health and lives and livelihoods of our residents and our businesses. I fear because I and others have considered the situation from every aspect, and what we clearly know about COVID-19 tells us we need to take this action, and what we clearly do not know about how far and wide COVID will spread urges us as well to take this action. I know that every governmental entity represented here has been working this crisis every hour of the day and night in one way or another. In Wyandotte County, we have convened our community stakeholders for daily reporting, problem solving, consulting. This includes Mayor Jeff Harrington of Bonner Springs, Mayor John McTaggart of Edwardsville, our public health officials, the superintendents of our 4 public school districts, and the superintendent of our Catholic schools. It includes Dr. Mosier of Kansas City, Kansas Community College, Monsignor Swetland of Donnelly College, the leaders of our mental health providers, our social service providers, executives of Providence Hospital and the University of Kansas Health System, the General Manager of the Board of Public Utilities, and of course, Unified Government staff. On these calls as well are staffers from Senator Moran's office and Representative David's office. These conversations have proven invaluable. We have deepened our understanding of the crisis. We have broadened the scope of our approach to solving the multitude of problems presented by the crisis. It has enabled us to communicate accurately and clearly. And most importantly, it has intensified and sustained our common desire to do what is necessary to win this fight. I offer these remarks because even though we find ourselves in trying times, I am very encouraged. I have personally witnessed in our community and in the greater community of Kansas City a brilliant display of expertise and insight, of willingness and ability to lead, of fortitude and selflessness. Yes, we experience well-founded fear, but we do not cower and we do not hide. That is not the spirit of Wyandotte County, nor of the Kansas City region. I'd now like to introduce Jackson County Executive Frank White.
Good afternoon. We're living in unprecedented times, and I'd like to thank our medical professionals and our first responders for the great work they're doing in combating this disease. As chief elected officials for over 1.5 million people, together we represent 2 states, 6 counties, dozens of cities, hundreds of communities across the entire metro. Each of those communities is as unique, diverse, and beautiful as the people that call them home. Individually, we are a diverse group of people. We come from different backgrounds, political affiliations, religious beliefs, and much more. Today, despite our differences, we stand and speak united as one. United in the knowledge, understanding, and appreciation for the days, weeks, and months ahead, knowing that those will not be easy. We're united in our knowledge that those who acted quickly and decisively have saved lives. We are united by the necessary actions we have taken to support and protect the people of our communities, most importantly, those who are most vulnerable. We stand united in our belief that our communities are strong, passionate, and loving. Together as one, we will overcome challenges that lie ahead. We are confronted in our belief that our best days are ahead of us. We will emerge from this stronger, better, and more united than ever. We are proud of our citizens in each of these communities for acting so quickly to adhere to our orders to keep our communities safe. You've done an amazing job, and I thank you. Mayor Alvey, Chairman Eilert, I hope you don't mind, but I'd like to conclude. Before I conclude, I'd like to say a message to our dear friends in Kansas City, Kansas, and Johnson County to stay strong, stay safe, and stay home. To Mayor Lucas, my friends, and my family, and all the people who call Kansas City, Missouri, their home. Please stay strong, stay safe, stay home. And to the amazing people of Jackson County who have given me the distinct honor and privilege of representing them every day, please stay strong, stay safe, stay home. Thank you, and God bless us all. And I'd like to introduce Chairman Eilert from Johnson County. Thank you.
My name is Ed Eilert, Chairman of the Board of Johnson County Commissioners. As has been indicated, These kind of decisions are never easy and are very difficult. But the objective of these decisions is to protect the health of our total community. We have thousands of people who cross county boundaries and state line every day to work. And the security of their health has to be important to all of us. About a week ago, 10 days ago, our county issued emergency orders and affecting our schools, affecting our churches, and others. We have expanded that in the current order that has and will be implemented. In the previous order, all private business organizations were exempted. Now, even though that was done, many of our business organizations have taken steps on their own, working with their employees to do what they can do to provide work opportunities at home for their employees. I would hope that every other business in our community and the metro area would take that same action if you have not done so by this time. The new executive order identifies essential businesses that will be excluded from the stay-at-home order. But again, I hope that those businesses work with their employees in order to provide the same level of safety that others will have. We have a hotline number, 913-715-5000. That number will be manned from 2 to 8 p.m. this afternoon and during regular business hours beginning next week, 8 to 5. The orders will be published on our website. They will be published on social media. Please look at them, read them carefully, and we encourage you to participate to the fullest extent that you can. This is not a minor issue. I think we've all seen what has happened across this country and across this globe. This is serious. And it's only with the total cooperation of our community taking appropriate actions that have been identified by the CDC and our local health officials can we be successful in mitigating the spread. The critical point, we have been in conversation with our CEOs of our hospitals the last several days. And one critical point is that we not be in a position where our hospitals are overutilized, are crowded, and are not able to attend to the care of those who really need it. So I would encourage you, stay at home, be careful, follow the social gathering guides, 10 people or less, and the social distance, hand washing, and together we can make a difference in the issues and the challenges that we face today. Thank you very much.
So good afternoon. My name is Quentin Lucas. I'm the mayor of Kansas City, Missouri. I want to thank George and the team at Union Station for having us here. And as I was listening to our speakers, I realized that it was only about 5 or 6 weeks ago that we were here celebrating as a region, the Kansas City Chiefs Super Bowl, an opportunity for us to come together from throughout Missouri and Kansas to actually talk about these great accomplishments in our region. At that time, we recognized that there were no lines, right? Nobody was asking if you were a fan from Kansas or Missouri or anywhere else. We recognized we stood as one and one community. And that's why we're back here today. In times of celebration, in times of pain, in times of sacrifice, we recognize that there aren't lines, that our regional distinctions, our boundaries, our different jobs, our different titles matter less, because public safety, public health, our community's survival are so important. I'll only say a few comments, then we'll go to questions. One is there's a reason that we have all of the medical professionals with us today. Because when we, as political actors, note that we've been working nonstop, I feel like they've been working twice as much. I don't know how they have the hours to do it. I commend our health director, Dr. Rex Archer, and all health directors, not just here in the metropolitan area, but from throughout the states of Missouri and Kansas. Regional health directors, county health directors from small communities throughout our region who have talked about how important it is that we flatten the curve, that we come to a solution, that we work together, that we speak to our state and federal officials to say how much it matters right now, that we look at so much of what we need to do to make sure we have necessary hospital infrastructure, economic infrastructure, public safety support, and engagement to make sure we get through this current crisis. One other point I want to note is this. I do think that it is profound that we have come up with an order of the type that you've seen. And it's not just us. This morning, Leavenworth County issued an order that's substantially similar to what we issued in Kansas City, Missouri. I'll be kind and note that Mayor Alvey and his friends in Wyandotte County gave us lots of ideas as to the order we've issued. And just in recent hours, we've been able to see an order issued in Platte County. What that suggests to me is that everybody gets it. Everybody wants their communities to be safe. Everybody understands that this isn't just an issue of one community or another. But I'll note two other things. One, we know that right now there are folks in our homeless populations. There are those in low-income communities. There are those that, if not already affected, may be affected disproportionately. I encourage any of you who has the opportunity to provide financial support to do so. But more than that, I encourage all of us in government not just to work together on orders like this one, but also to work together to make sure that we can support our most at-risk populations, to make sure that we can help those who will suffer through economic pain, based in no small part on the choices and the decisions we have to make today. And then I'll make this other point, which is to say that I know a lot of people ask, when is this all done? And unlike other tragedies we've experienced before, we don't have a clear answer. What we know is that we're going to do what is necessary to make sure our community is safe. That's why we see this order lasting 30 days. That's why we're all going to continue getting on the phone, even on days when we're very busy, to make sure that we're doing what can help our region the most. And so with that, I thank you all for sharing this message. I encourage everyone to be responsible. There's no need to go out and hoard. There's no need to go out and fight others. But more than anything, let's make sure we're taking care of each other, whether that's someone across the street, across the state, across a line, we're all in this together. So with that, I know there may be some of you with questions. I think it might be easiest for us to go from left to right. So get your question ready, Eric. He always asks tough ones. And to the extent that you have questions for anyone specifically, feel free to do that. So what I might just ask for ease, because we are following social distancing, if there are any questions for me, go ahead and just pepper them with me. And I see some of our KCMO organizations here, left to right, so I'll start with Eric. Yeah. So the questions from Eric Wesson of the Kansas City Call related to a rule as applied to funerals, and then what type of work are we doing for small businesses. The recommendation we've gotten from medical advice, and this is why we speak to funerals, weddings, so many others, is that we are trying to fight community spread. And we realize that there are, and it's heartbreaking for me to say to someone that you can't have the funeral or the wedding or any type of observance in the way that you would like. But what we have said, and this is with the help of Dr. Archer and our other health professionals, is that we're trying to make sure that we, first of all, can limit the spread in those situations. Oftentimes at a funeral, you'll have an at-risk population that is there. We're trying to make sure that there's adequate social distancing at all of those types of services. And frankly, that would apply whether you're at a wedding, whether, frankly, you're outside, whether you're at a funeral home, any type of service. And so we're trying to make sure you go through those steps. In Kansas City, if you're looking for an exception of funerals, you can call the health department or just call 311, one simple number for us. But I believe what our health department will tell you is that we still require social distancing. We still require no handshake signs. We require you to have a registry so we can see all who were there in case we do need to trace at some point later. But another point is that we think that these steps are necessary so we don't run into a situation you've seen overseas where there are lots of people being buried without any type of observance at all, because of that volume. So that's what we're working on there. In connection with help for small businesses, first of all, I do want to commend both of our governors in Missouri and Kansas for activating resources in connection with the Small Business Administration. I encourage anyone to reach out to those resources as much as they can. From the local government side in Kansas City, we're evaluating to what extent we can delay or remove fees in all situations. We understand in Kansas City we have an earnings tax, the due date of which, if you haven't paid regularly in your paycheck, is right now April 15th. We're looking if we can make an extension there that would align with our state and federal extensions to July 15th. And we continue to do substantial work, and I thank the folks who are with me here to see how we can partner with nonprofit organizations, the Mid-America Regional Council, the Kansas City Chamber, to see if we can create stimulus funds to help support folks. And so those are some of the steps in Kansas City government as well. We're trying to come up with as many funds as possible to help support people. So those are the steps so far. I expect to be able to announce more as time goes on. Michael? In terms of enforceability, so I'm going to be honest, and maybe I'll give away the farm. And I think Chairman Eilert had mentioned it. We hope that most people, actually, like a lot of businesses, both in Johnson County and Kansas City and throughout the region have already done, frankly do something that I call self-police, right? It's your own self-enforcement. This isn't something that we're just trying to force on to people. It's something that is actually making your workforce, your neighbors, your community safer. And so that will be a large part of it, self-enforcement. Businesses that recognize they have folks that can stay home. To the extent that our own enforcement powers are necessary, we have a few different steps. One, these orders, at least in Kansas City, and I would assume knowing a little bit about law in both states, are similar to what you typically see in ordinances. And to the extent that you are violating them, this is an ordinance violation. The penalties of which usually include, in both of our states, fines. Often there can be a suspension of business activities and ongoing. So certainly for businesses that don't follow, we would look to have that. Usually we would receive reports from folks in connection with it, but that's how we'll go at this step. In terms of police involvement and enforcement, our police department, everybody else's police departments and sheriff's offices are very busy. I do not want them in the position of asking people where they're going. And so at this point, we continue to look to our health department, regulated industries in Kansas City, being your primary enforcers. To the extent we need to increase that, we will as necessary. But as for now, and I've been asked this already, do people need to walk around with something like passes or anything of that sort? The answer is no, right? What we are asking you to do is very simply comply. Care about your neighbors. To the extent you don't, to the extent you're an employee who's saying, you know what, I'm working at, let's say, a place I don't go to often, a barber shop, and they're still making me come in. And I don't think I feel safe that way. You can call 311 or you can call any of the numbers we've described so far, and I think that gives you an answer. And I'll try not to take too many others, but Emily, did you have one? I'm having trouble hearing, I'm sorry. Understood. All right, Chris, help me out, because I was just saying for the question. Yeah, but that's a great way to do it. Sure. As for grocery stores and other places that are exempted, we stick to the same directive that we had before, which is basically you have to follow code. At this point, we have not needed to reduce the numbers that are allowed under your same fire marshal codes, that sort of thing. But we do ask you to follow social distancing. We have heard lots of reports from folks that suggest those social distancing rules and requirements have not been followed at places like your grocery stores, your your larger stores, that sort of thing. We encourage you to follow that. I know that we have seen police departments sometimes stationed outside of them to make sure that folks are following those rules appropriately. But for now, so long as people aren't responsible, we don't think we need to reduce that. However, Dr. Archer and I have discussed this in the past as for saying, do we need to go to a percentage of total occupancy allowed? Right now, we don't think we have to do that. But if we have people that hoard at certain times, if we have people that are crowding places, if we think procedures aren't followed and we think there's a significant risk of community spread, then we will reevaluate those orders much like we do in connection with anything else. One other thing that I will ask is I know a number of stores have created hours for folks of an older population to go in the morning. I would ask people to observe that. I think that has been helpful for us, and so that's important. Another thing, just be kind when you're at those places. Right? A lot of our grocery workers, so many others, are working their tails off right now and, frankly, aren't receiving the pay increases that some others may see in times like this. So make sure you're respectful to your fellow shopper. Make sure you're respectful to workers as well. I'll take one other question, and then I'll move out of the way. Yes? So all of the 14 school districts that have buildings in Kansas City, Missouri, and a number of our charter schools, parochial schools, and others, do provide lunch programs for students. Most of those districts have communicated efforts in which they will continue to either, in some situations, deliver food to students or in certain areas, and there aren't deliveries in some, or creating food availability at the schools or other central locations. That's something where you would typically be communicating with your school districts, and all of our orders, at least the order I know we issued in Kansas City, Missouri yesterday, allow for those types of essential school operations to continue throughout the pendency of this order. We understand that, and perhaps it's a shortcoming of society, but it's the way we are now. Lots of times children have to come to a communal place for social services. We will do whatever we can to make sure those continue to be available, whether that's the provision of health services, food, counseling services, or another important step where we're allowing schools to continue to do that work. Every superintendent I know in Northwest Missouri has worked to make sure that we're continuing on in those processes, and that's something that we'll continue to work towards. I'll get out of the way and allow one of my peers.
Yes, I think we really shared the same documents that we work from. And so I think what you're going to find, they're fairly consistent from county to county. But again, I recommend for our people, go to the website, the UDG website. We have all resources necessary to try and answer your questions about COVID. And if you do find a question, have a question that is not answered somewhere on that site, please communicate with us so we can make sure we get that information out there.
I'm sorry, I did not hear the complete question. I'm sorry, I reported about what? Oh, well, I would encourage anyone to go to jocogov.org. There is a special section dealing with COVID-19. And to the previous questions, all of the orders are consistent. There may be some minor changes from county to county, but in general, they are completely consistent.
Oh, Eric, we are working on a plan now. We don't have it complete yet, but we're working on a plan that's going to do more than help small businesses. But we also going to aid Truman as the safety net hospital, so make sure that we have all those things covered. So we haven't got it complete yet, but we'll be announcing it pretty soon. Well, I'll have to check with Bridget, our health director, and ask her, is there an issue there, Bridget? I know there's everywhere else. I'll have her come up. Thank you, Bridget.
Bridget, I'm the director of Jackson County Health Department. There is a nationwide shortage of supplies, and many hospitals are looking at getting additional PPE. Yeah.
Again, Alan Greiner with Unified Government. A ventilator is a machine that essentially breathes for a very ill patient. So if someone becomes sick enough, which we've seen that this virus can do that to many, many, many people, and a person is having severe respiratory symptoms, oftentimes, unless they have a tube put in their throat and a ventilator hooked up to that tube, they would expire immediately. Often these ventilators can be very life-saving for somebody in that situation. We have shortages in other cities like New York already, and we're concerned about that. So again, this order is to do something like prevent having people in a hospital who can't get on a machine that would save their life and literally expiring right there in a place that would normally be capable of saving them. We've had a significant problem with regional testing capacity in the Kansas City metro area. A number of the hospitals that we all have been talking to have expressed frustration. Part of the urgency of this stay-at-home order is that without the ability to do testing widely across the population and test absolutely everyone that has symptoms like fever, cough, shortness of breath, we need to reduce the spread this way because it's unlikely we'll be able to test everybody and know who has it and who doesn't. We're working diligently to obtain more tests. I know physicians and hospitals that are making calls all over the world trying to find companies that might be able to give us additional testing supplies and provide additional laboratory capacity to get these done. Again, we urge people who have symptoms to work with their primary care providers. Some of those individuals may end up being considered a presumptive case of COVID-19, and there may not be quite as much urgency to test them as someone who might be showing up to an emergency department or get hospitalized. But again, work through your regular healthcare providers. If you don't have a regular healthcare provider, we've actually set up a partnership with a clinic in Wyandotte County, Southwest Boulevard Family Healthcare, that has an information line. It's 913-396-7070. They can take questions across the metro for patients that have any questions and do not have a healthcare provider. They also, for those who really need testing, have some testing capacity, and they have a drive-by testing facility on Southwest Boulevard in Kansas City, Kansas. I'm going to turn that over to one of our other experts here.
I know that Evergy has already agreed that they wouldn't be turning any power off during this time, and I would assume that it's going to go down the line with water and gas and so forth. But I think everybody realizes the situation that we're in, and guys are staying home. They work with unemployment. This is on the federal side. They get full employment rather than partial unemployment. So these are a lot of things that are still coming down the pike from D.C. But I think that locally we're concerned, as everyone else, about power getting shut off, water getting shut off, and it's nice that Evergy stepped up early and said that they wouldn't be turning these off, and also we're just working with the water department and so forth that in Kansas City to see what their policy is. But I think right now it's all about people and saving lives and making sure that people take the steps that we can get that done. I don't think there are any plans in place because I don't think we've had that issue here at this time. I think every time you see something somewhere else, you start paying attention to it here. I think that is definitely a concern. But when we went into these orders, we try to get this done by giving our citizens still as much freedom as possible, but at the same time, it's self-policing. It's staying at home. You can go in the yard with your family. You can barbecue. You can do a lot of things that families do, but we just encourage the 10-person limit, group gatherings, group parties. But I did listen to the governor of New York this morning, and he was highly upset by that. And so I think it's just more of self-policing and making sure that you are taking care of the people in your community and just watching what their habits are and then reacting to what their habits are. Well, the courts aren't completely closed. Some things are essential, and you still have to have happen. But what the courts do in this case is they look at a lot of low-level offenders who are maybe they're on warrants and not any serious violations. Inmates that could be possibly let out on with ankle bracelets. I know in St. Louis they've released over 200 inmates that way. And we haven't done that yet. And they have apps on their phone where the inmate can check in during the day so they'll know where they are, things like that. That would be a question for the courts. That would be strictly under the court's jurisdiction, and we haven't heard anything yet.
So we're watching all the other places in the nation that are a few weeks to a month or so ahead of us in the epi curve, seeing how these techniques are working for them. I do want to address a couple other quick questions. There is a difference between the density in New York City, the populations, and their parks, and the tendency to be able to overpopulate. We don't have that same density here. People that are staying at home, we know that moderate levels of exercise are actually good for the immune system, so we encourage people to be walking, getting exercise, just maintaining social distancing. I wouldn't be sitting together in a dugout with baseball next to each other or playing basketball where everybody's touching the ball and contaminating it. You're having that kind of congregation of activity, but physical activity is important. Walking your pet, whatever, people need to be out and doing that. Ask the question again. I want to make sure I'm addressing it. Oh, yeah. Okay. So the challenge with this epidemic is that for over half the population that will get this virus, they can stay at home and get well without medical care. They may think, well, then they're not part of this issue, but they're the ones that also spread it to the high-risk folks. So we'll be watching and monitoring bed capacity in the hospital, availability of the ventilators to be able to save lives when people do have problems, because for a percentage of people, when this virus gets deep in the lungs, it attacks and kind of destroys the lungs' ability to move oxygen, and that's why we have to have the ventilator to save those lives. So this is going to be a process that we'll be constantly watching and monitoring enough lab testing. We have to watch what these other individuals.
Now, regarding the mask shortage, can I just ask you, around the country, people have been making masks and actually donating them. How can people help during this time with the shortage of the masks?
We're hoping that order and that he will be gearing up, just like the war times issue of other kinds of military equipment in wartime, that we can get all of our industries moving forward on those things. The main thing now is we're staying at home. The virus isn't spreading as fast. We don't need as many masks. So that's why we've got to take these measures.
Dr. Arthur, can people have funerals outside? And would that be different with the social distancing than if they had an inside building?
So we want to work through this because this is kind of unprecedented. If you remember, the way that Ebola was spreading in Africa was part of their religious processes of cleaning the body and all of that. They had to make that cultural change. I really think in the short run, we're going to have to be making significant cultural changes with our funerals and other ceremonies. We've talked about some different guidelines we've kind of got on our website to try to work through with this. If you're maintaining enough social distancing, then yes, you should be able to do it outside, just like we're allowing people to participate with events in parks if they're spread out enough. But we've got to stop that line where everybody's going through and shaking hands and giving those condolences. If you're having a guest book sign in, sanitizer before you sign in, sanitizer afterwards. We're actually asking people to include the phone number when they sign in for a guest, so that if we have to make quick contacts because people got exposed at the event, that we can follow up. We've got 3 deaths at least in the metro area. This is not something we can ignore. We've got to take some strong measures.
Chairman Isle.
Excuse me, may I respond to a couple of the earlier questions, especially in regards to the courts. District courts in Kansas are under the responsibility of the Kansas Supreme Court. I know they have taken measures to reduce those who need to come to our district court, but if you have specific questions and you have a legal representative, you should consult with that individual. But I know there will be no new jury trials for a period of time. And there are other important activities that must occur. So again, check with your legal representative or the court. One last thing I would like to say, in our county, our schools had spring break this week, and there will be many, many people coming back spring break. If you visited the skiing areas in Colorado, a lot of publicity about the beaches in Florida, and there are some other areas. You must self-quarantine for 14 days. And I emphasize that's everybody's responsibility. We don't know where you've been. You know where you've been. And so if you've been in one of these, I call them toxic areas that KDHE has identified, then please, please, please self-quarantine. Don't be out in the community. You may not have any symptoms, but you may carry the virus. So that's the reason for the self-quarantine. I just want to emphasize that personal responsibility. Thank you.
Mayor, yeah, Executive White, if I could, please, and then anybody else who would like to respond. I'm Dr. Rodney Hammer with the Blue River Kansas City Baptist Association, represents 130 churches in Jackson and Cass County. And we believe and would like to ask that the essentials list should include churches with all the public health admonitions as a given, social distancing and so forth. The churches should be included in the list of those groups also, allowed to meet with 10 or less with social distancing. And we believe it's discriminatory to single out churches for their inability to meet according to the public health guidelines that have been published. And I believe what Dr. Archer just shared about funerals should be applied to the ability for a church to have outdoor or drive-in or inside. And you can't even do a live stream or a recording with in many of our churches with less than 10 people allowed to be in the building. So we'd like to ask that the Core 4 reconsider and allow churches to be on the essentials list for staying. Mental health, spiritual health, and the opportunity to give hope and encouragement is important. And our community department, we're providing many of these.
That's a request, not really a question for them right now to answer.
It's a question if you'll do it.
I believe it's something that the Core 4 can discuss, for sure. Yes.
I'll be glad to respond to that question. As I said, a week, 10 days ago, we issued an emergency order. That order was amended this past week. It originally excluded faith-based organizations, but that was eliminated from the emergency order. So meeting in groups of 10, you can still carry on your church, your religious activities, but you must meet that requirement. My congregation, we've not met, didn't meet a week ago. We didn't meet this Sunday. but many of our congregations are engaged in electronic communications, and we would hope that that would continue. Pardon? Well, again, if they have more than 10 staff, as long as they're not congregated in the same place, it's kind of like a business. A business might have 50 staff, but as long as they're separated and not congregated in groups of more than 10 and the social spacing is observed, that's fine.
But before we go to that, again, from the medical and public health side of this, requesting that changes be made to these documents is not going to save lives. Staying home is going to save lives. And we're talking about all of us as individuals, but we're talking about our families, we're talking about our friends, our neighbors, our communities. I think we need to think about what's the safest thing. And trying to find ways to get 10 people together in a park or otherwise is not going to save lives. And it's not going to help our hospitals from ending up completely full of people and having people dying in emergency rooms because we don't have enough equipment to keep very, very sick people alive. We're going to have variations. We're going to have variations across the different organizations, slight variations, because our lawyers are working together, but we're going to keep working through this as best we can. We need all of our communities to do what Mr. White said. Stay strong, stay safe, please stay home.
I'm going to do I'll do the public transit, and then I think we'll stop. And I'll note this. So there was a question regarding public transportation and the airport. The Kansas City International Airport remains open. It will continue to remain open unless there's a further order in connection with it. The train station here at Union Station, by the way, remains open and operational. What are special approaches that we're using in those areas? A few. One, we have increased the schedule of cleaning at the airport, replacing soap more often. Our KCATA buses throughout the region, streetcar, et cetera, have heightened cleaning. KCATA and the Kansas City streetcar on a reduced schedule. In consultation with the Kansas City Health Department, we have also enforced more social distancing, i.e. blocking out seats on KCATA buses. We will continue to speak both with the Aviation Department, public health officials, the FAA in connection with the airport of steps that are necessary. At present, if someone lands at KCI, they don't need to go through any additional screening. That is partially because it is yet to have been recommended by federal officials. At which point that we think that it is essential, then we will make sure that we take that key step as well. We've already had several situations where an airline crew has called us in advance saying that there's a passenger who is ill. Usually in those situations, we're able to have both paramedics and other officials with proper protective equipment come quarantine the person upon landing, ask them a series of questions, get them medical care and assistance that they would need thereafter. So that's what I would say in connection with that. Our buses, we will try to continue to have our buses run throughout the duration of this crisis if we can. Certainly if we get to a point where there's an order that suggests we need to shut down a public transit system, we'll do that. We will note in this country so far, we have not seen that. We hope to not get to that point, and we recognize that those folks need access to food, medicine, all the type of care that everyone else needs. So with that, we want to say thank you all for being here. I'm sure lots of us will be available for questions, and we will look forward to trying to speak in unison in as many opportunities as possible. Thank you.